Hello there, I'm Dr. Azam Khan, and today I'm going to show you how to examine the ankle and foot. With me is Oas, who is a cricket player. He has volunteered himself for this task. I'm going to, before I examine the patient, I will take the detailed and complete history of the patient, and I would like to have a proper exposure, which ideally should be from knee above. First of all, I will do the generalized inspection, see any deformity, any muscle wasting, bunion formation, or any visible anatomical variant like pes planus or pes varus. I can easily see Oas' feet are into the planus formation. They are more flatter. His arches are dropped. So just to check the integrity, and you see that, and they do not reconstitute very well. So next, can you turn around for me? From the posterior view. Again, I would have a look at the any atrophy of the calf muscles. From backwards, I can see that the couple of toes. There are too many. There is no sign of too many toes, which, if it is there, which shows that it is a sign of the posterior tibialis dysfunction. And thanks, please. Can you walk around for me, please? No, you can turn around, please. Can you tiptoe, please? On the tiptoe, keep standing, keep steady. On the tiptoe, you can see the movement of the calcaneus, which goes in from neutral to the varus position normally, and it does in the case of Oas. Thank you very much. I'll also have a general look at the gait of the individual. Can you walk around for me, back and forth? Now, come back again for me, please. So I'll look for the cadence for which part of the foot strikes first, the stride length, any intelligent gait. Thank you very much. Or hyperpronation or overpronation of the heel. Thank you. Next, we will perform the active range of motion as well as motion against the resistance. Can you sit down for me, please? Right. Bring the foot upwards, upwards, and edge up, and downwards, downwards, inwards, inwards, and outwards. Right. Can you bring the big toe downwards, and घुटना नीचे लेके आओ ना, नीचे ऊपर की तरफ, upwards. Thank you very much. Now I'll do it, the same movements against the resistance. Just check the strength of the foot muscles. Can you push against my hand? Upwards, ऊपर की तरफ. यहाँ मेरी तली होगी, ऊपर की तरफ जोर लगाओ. यार इस पे ऊपर. Push against my hand. And now downwards. Inwards, please. Oh, very good. Outwards, please. Now with the big toe, upwards, downwards. Fabulous. Thank you very much indeed. The power of the muscles acting on the ankle is pretty much normal. Now I will come down to the palpation part. I will start the palpation from calf belly. To look for if there is any pain, please let me know. The calcaneus tendon, Achilles tendon, for any deformity, like aberrant deformity. Then I'll start from the tibia, look for any tenderness here. The medial malleolus, the posterior tibial tendon, the tarsal tunnel, then the navicular bone and the tubercle, right, and then head of the fibula, downwards the lateral malleolus, anterior talofibular ligament, calcaneofibular ligament, and the posterior talofibular ligament. Then the peroneal tendon all the way down to the base of the fifth metatarsal. Then the talar dome. Look for any tenderness here posteriorly. The heel pad, the calcaneal heel pad. Look for any sign of plantar fasciitis. The plantar fascia, heads of the metatarsal, they are absolutely fine, and base of the fifth metatarsal. And look for the interdigital spaces for any sign of fungal infection. Thank you very much. So after I've performed the palpation part, we'll come down to the special tests. Among the special tests, first of all, I will check the integrity of the lateral ankle ligaments, which include anterior talofibular ligament, calcaneofibular ligament, and the posterior talofibular ligament. First of all, I will check the integrity of the ATF ligament, the anterior talofibular ligament, with the help of the anterior drawer test. For the anterior drawer test, hold the lower part of the leg, and then the calcaneus, distract it downwards, and in a slight plantar flexion, I'll switch my left hand to the anterior part and push posteriorly to check for any displacement. A displacement of 5 millimeter and a pain in the region of the ATFL laterally is positive for the anterior drawer test. Next test is talar tilt test, which also meant for checking the integrity of the lateral ligaments of the ankle and check the hold the calcaneus firmly and your left hand over the lower part of the leg. If we and forcibly invert the invert the calcaneus. If we do this in plantar flexion and invert the calcaneus, normally it stresses the ATF ligament. So if it stresses the ATF ligament and if there is pain in this area, it's positive for ATF ligament. To stress the calcaneofibular ligament, I will do it in the I'll place the foot in neutral position and again invert the foot, and then to check the posterior talofibular ligament, I'll bring the foot into dorsiflexion and again invert the calcaneus, look for any pain. This was the talar tilt test. Thank you very much. Next test is next couple of tests are to assess the syndesmosis sprain, any syndesmosis sprain. First is the squeeze test. I normally start from the proximal end and squeeze the tibia and fibula together to bring about any pain if there is any syndesmosis sprain. So if the pain is on the higher side, there will be pain on more proximal side. If there is pain on lower end due to syndesmosis sprain in the interosseous membrane, the pain will be in the lower side. Next test for the syndesmosis sprain is Klieger's test, and to do the Klieger test, it is also known as the external rotation test, which pretty much simple test. We in fact hold the foot from here, from the inside, and stabilize the knee. If we perform this test in slight plantar flexion and evert the foot, I can hold it from here, evert the foot, there is a tension and a stress on the medial collateral ligament or deltoid ligament. There is a strain of the deltoid ligament that will hurt and that will reproduce the pain. While if I do this test in more dorsiflexion, the pain will be in the syndesmotic area, in a high ankle sprain. So I will bring the foot into dorsiflexion, evert it or externally rotate it, and the pain will be in this region. Thank you very much. So we've finished with the test for syndesmotic pain. Next test is to check the we can squeeze the calcaneus for any signs of to reproduce the pain for the stress fractures. We can also do the Tinel sign over the tarsal tunnel to reproduce the pain. To check the motor neuroma, we can squeeze the forefoot with one hand and check for the pain or paresthesias here in this area. Finally, I will do the Thompson test. Can you lie down for me, please? Full direction. And this pretty simple test is to check the integrity of the Achilles tendon. We squeeze the calf muscle, and normally it plantar flexes. If there is a rupture of the Achilles tendon, the foot will not go into the plantar flexion. Thank you very much. Can you lie down straight, please? See the legs. Finally, I will also check the strength of the calf muscles. First of all, the gastrocnemius. Can you push against my arm? Abbas has a very good strength of the gastrocnemius. And can you bend the knee and push against my palm ke saath niche zor lagana. And he has a very good strength of soleus as well. To conclude my examination, I will do the neurovascular examination of the whole lower limb. I'll examine the knee joint as well as the lumbar spine. Thank you very much indeed.